Good morning, ladies and gentlemen. My name is Connor Stotts. I'm the diabetes nurse here at Indian Health Council, and today we have our Living Well with Diabetes class. With me, we have our special guests, our registered dietitian, Misty Faulkner, and our physical activity specialist, Wyatt Earhart.
Good morning, everybody.
Let's see. So, first order of business, I'd just like to introduce the team just to the patients who this may be their first time with Living Well with Diabetes. Once again, I'm Connor Stotts. I'm the nurse for Indian Health Council for Diabetes. We also have Lorelei Legaspi. She's not with us right now. She's our certified home representative, a certified nursing assistant. We have the mentioned Wyatt Earhart, our physical activity specialist, the expert in all things physical activity, and Misty Faulkner, who I myself have gone to her many times asking for dietary questions. She's a wealth of information. And if you want to call any of us, get more information, talk to us, schedule appointments, our numbers are down there underneath our names. You can call us anytime during business hours, 8 a.m. to 4:30 p.m. And you'll also, if you don't have time to write down this information, we'll also be showing it again near the end of the presentation. Today's topic is living well with diabetes. And whenever we do our living well with diabetes, we just want to cover the very basics of, what diabetes is, how to monitor blood glucose, meal planning, activity, medication, health maintenance, a diabetes toolkit. I found it's amazing that some people, even though they've had diabetes for years, they didn't have someone sit down and discuss the basics of diabetes with them, just in a clear and simple manner. And so hopefully we can get that across today.
So what is diabetes? Okay, let's talk a little bit about that. But first, before we get started, I just want to say the main 3 points that I want you to remember about being newly diagnosed with diabetes is that we first want to manage it with checking our blood sugar daily, or blood sugar or blood glucose. We want to make sure we're doing that daily. We also want to make sure that we're managing with diet and exercise. Those kind of are like, cousins, they go hand in hand. And then we also, if we're taking diabetes medication, we want to make sure that we're taking those as prescribed by our provider. So what is diabetes? So diabetes, just to simplify it, diabetes just means there's high blood sugar, high blood glucose. It's just too high. It's just too high in the body. And so with that, we often, might not feel very well, might not feel real good. So want to make sure that we're managing that and checking that. All right. So that's just what it means basically in a nutshell. It's too high. So now we're going to kind of talk about some of the risk factors for diabetes. So how did this happen? How did I get diagnosed with diabetes? Well, maybe you have a family history of diabetes, right? So maybe grandma, cousin, aunt, uncle that are blood related to you, that there's a history of that. That just because there's a history doesn't mean you will, develop diabetes later on in life. But that might be one of the reasons why you were diagnosed. Also, maybe you're spending more time sitting on, the couch, or you're not being very active. Maybe some things are going on in your life and you're just, you were exercising, then now all of a sudden, COVID came, past 2 years, people, weren't exercising anymore. So maybe you're not very physically active daily. We need activity daily. Or maybe you're over the age of 45. So when we start getting older, when we start getting into our 40s and 50s, that's when chronic conditions start coming into play, because we've had a life of, some choices that maybe were made, and now it's coming into play. So you're over the age of 45, they're actually going to usually start testing for that at your physicals when you're over that age. Also, if you're native, so native people, we have a high chance, or we have high insulin. We have high insulin resistance. We're very prone to that. So if you're native, if you're African-American, Latino, Asian, Indian, Pacific Islander, almost kind of want to almost just say if we're in the brown skin category, we have a higher chance of diabetes. And also if you've had gestational diabetes. So maybe your first pregnancy, you were diagnosed with GDM or gestational diabetes. maybe later on, maybe on your second or third child, again, you were diagnosed with that. So that gives you a higher chance of later on in life, when you hit those 40s and 50s, of being diagnosed with type 2 diabetes. You have a higher risk of that. Also, your child, the child that you were carrying when you were diagnosed with GDM or gestational diabetes, also has a higher chance of developing diabetes sometime in their lifetime. So it's really, really important for people to understand that you can set that up. So that's kind of where genetics come in, right, as well. So just making sure that we're remembering those kinds of things when we're pregnant, and that we're caring for ourselves and baby, because that does impact baby's health later on in life. So let's talk a little bit about numbers, right? Anytime we're diagnosed with something, there's numbers to be, to be in the mix, right? We got numbers all the time. So your doctor might have talked to you a little bit about goal numbers or your numbers, right? And so what does that mean? Well, it means we're going to check your A1c, which we will talk about a little bit later. And then I'll also go a little bit more into details about what the different types of diabetes are and talk a little bit more about that. But first, they're going to check your A1c. Just remember that later on, when we get to that slide, we want it to be usually less than 7. If we're a little bit more advanced in age, a little bit, we might maybe like over the age of 80, might be actually, we want it less than 8, but that just depends if you have other chronic conditions going on, and that's what your provider might want you to be in that range. But generally speaking, we want you under less than 7%. We want that A1c less than 7. And then when we're checking our blood sugar before meals, so we haven't had breakfast yet, we haven't had anything to eat yet, we want it to be between 80 and 130. That's kind of the sweet spot where you're more than likely going to feel a lot more comfortable. You're not going to feel woozy and things like that. You're just going to have a lot more comfortable day and have more stable blood sugars. And maybe in the beginning, it's not going to be in that range. And that's okay. We're not going to panic about that. We want it, though, to be 80 to 130. That's kind of the sweet spot where we want to strive for fasting before we've had a meal. And then after we've had a meal, so that 2-hour window, depending on your provider, they might have something set up different for you. We want it to be less than 180. Now, just keep in mind, if you had blood sugars 300, 400, 500s, it's not going to automatically just push right on down to less than 180 on a consistent basis. You're going to have some fluctuation, but it will. That's kind of where we want it to head, right? We want it to be less than 180 after we've had a meal, about 2 hours after you've had that meal. Okay, so just those are just kind of some general numbers, and some people are different. So we don't want to put you in a category, right? Everyone's different. So some people might run higher for a longer time, and some people, they might be able to get that blood sugar down a lot quicker. Just depends on the person. But don't compare yourself to other people. You are your own person, so you work in your own time frame. So again, less than 7% A1c, less than 180 after we've eaten, and then 80 to 130 when we take that blood sugar first thing in the morning. Okay. So what is diabetes, right? We're still on that, but this is really understanding, this is the heart of, your diagnosis, what is going on. So in the picture here on the slide, there's 3 pictures. Those are pancreas, the little yellow drawing there, it's a pancreas. So that is involved in making your hormone insulin. Okay, so we're not going to get too graphic here, but it's just, that's what makes the insulin. So the first part, you see what we're considering healthy. So that pancreas, it's going to release the hormone insulin. And then it's going to bind to the cell, or it's going to connect to the cell, right? That cell is going to open up, take up that sugar, okay, or that blood sugar. That's a normal reaction. That's what we're looking for. And so really what's happening is when our insulin or our blood sugar is high, that means it's kind of, think of it like a cup. We have a cup of water, and say you have an 8-ounce cup of water, right? Well, we're just pouring water. Well, it can only hold that 8 ounces, right? It can't hold 10 ounces or 12 ounces because what happens? It's going to spill over. Well, then when it starts spilling over, that's when, it doesn't have any more room to hold any more blood sugar. And so now insulin is just pumping and pumping and pumping and pumping, but it can't take it up. It's like a wet mop, right? It can't take up all that extra. It only has so much capacity, or can only fill up so much. And then once it's completely full, it no longer can take up any more water. So kind of think of it like that. We've got insulin coming in, blood sugar is high, the body's going to keep producing more insulin, more insulin, more insulin. It's just kind of like a ladder effect, right? So that's kind of where, diabetes comes in. So healthy cell, it's able to do that. Sugar comes in, it's able to open up, take it in, use it for energy in the body, and then everything is fine. Your blood sugar balances out. Well, type 1 diabetes is a little bit different. So that's actually an autoimmune disease. So what the heck's an autoimmune disease? Well, an autoimmune disease is something that happens in our body. And what happens is that the body sees it as an enemy, or it wants to attack it. So it sees it as an invader, right? So it comes into the body, that blood sugar comes in, and the body says, oh, it's, this is an invader. What is this? So that's what an autoimmune disease means. The body is attacking itself. And so the body just stops making insulin. So that pancreas there, it's not going to produce really any insulin anymore. And so a lot of times those patients will have a continuous glucose meter. They'll have a monitor, on them, insulin pump, they'll have an insulin pump. And so that insulin will come in and, adjust and all those types of things. So they need insulin for life. Okay. So they actually do need insulin, but type 2 diabetes, which is what most people are diagnosed with, comes later in life sometimes, right? So 40s, 50s, right? Sometimes people are actually being diagnosed younger nowadays, but that comes in a little bit later on, and it's not an autoimmune disease. So type 2, the body is not able to use that insulin well, okay? So it's either can't keep it in the blood, it can't keep the blood at normal level, right? It can't keep the blood sugar normal. So that's what type 2 diabetes. And so what happens is that insulin, again, keeps coming out. See in the picture, all the insulin is being released. The glucose, the cell is opening up, but the cell is so full of sugar already, it can't take any more, right? It's already full. The cup is full. Your cup is full. It can no longer have any more water poured into it. And so then the blood sugar just goes up and up and up and up. And so that's what type 2 diabetes is. Okay. So that's kind of the simple version.
That was a great explanation, Misty. Thank you. I'm Wyatt. I'm the exercise guy here at IHC. I'm going to start off talking about high blood glucose and why exactly is it a problem. So hyperglycemia or high blood glucose basically occurs when there's just too much glucose or too much sugar in the bloodstream. And generally as a type 2 diabetic, we're not using our insulin effective enough to store it. So it's often a condition linked with diabetes, and it's generally when our blood glucose is higher, like Misty said earlier, over that 180 range. So there's many risk factors. Like we said type 2 diabetes is a risk factor for hyperglycemia, high blood glucose, race, overweight, other conditions such as high blood pressure, cholesterol, and then also if, basically on your family history, that's all dependent on that. So when you have high blood glucose, there's other conditions over time that can cause health conditions. So we said with type 2 diabetes, it's a head to toe condition. So if it's untreated for long periods of time, definitely has potential damage to your nerves, blood vessels, tissues, and other organs, can increase your risk for, heart attack, stroke, and potential eye damage, all stuff that we want to stay away from. And as life coaches here at IHC, want to help you help manage that blood sugar. So if you're managing your blood sugar, it's very important that you have a blood sugar monitor. So that's something you can pick up here at IHC. It's really important to manage and check your blood sugar throughout the day. If you get on a routine, it's a little bit more easier. So maybe the first thing that you do in the morning when you wake up before you eat or drink anything, go ahead, check your blood sugar. Possibly before a meal, breakfast, lunch, or dinner, check your blood sugar, kind of see where it's at. 2 hours after a meal, see how that changes depending on what you eat. I know our dietitian can go in a little bit more detail with that. And then also possibly at nighttime as well, it's good. Make sure to check your blood sugar. So we have blood sugar monitors here at IHC, very simple. We can all walk you through that process. And there's other monitors out there currently. You probably have seen many commercials for Freestyle Libre. Those are your continuous glucose monitors. I'm not going to go into real depth right now on what those are, but basically it's a device that you can implant into your body, and it can read your blood sugar throughout the whole day. It can give you readings for weeks and months at a time, and it just kind of gives you a better look at your blood sugar. But this isn't an ad for Freestyle Libre or anything like that. Just saying, it's potentially something you can look at.
A1c. So the big A1c, right? We mentioned earlier that we would get to the slide and we wanted that to be less than 7 for most people, and then less than 8 for, people who have other chronic conditions going on and might be a little bit more advanced in age, but mainly less than 7, unless your provider has a different number for you, or you and your provider have worked out a different number that you're looking for. So what is the A1c? Well, as you can see there on the slide, I have a picture of a red blood cell, okay? And then on that red blood cell, there's sugar. So the blue represents the little circles there. Blue represents the sugar. So a normal red blood cell is going to have a little bit of sugar on it. It's going to. And so that's okay. That red blood cell is going to carry oxygen throughout all the body, but mainly to those organs. So a few slides ago, we talked about the impact of high blood sugar on the body. Well, if our blood sugar is high, then on the picture on the right, that's what it looks like. It means that red blood cell is coated with sugar. Well, what does that mean if it's coated with sugar? Well, that means that your blood is going to be thicker. It's going to be slow. It's going to be like the tortoise and the hare, where the tortoise is, kind of just going slowly, but the hare is just running really quickly, right? So that blood is going to be moving slowly through the body, and it's going to keep rising and rising, right? And also, it's not going to get to those organs. So the organs are not going to have oxygen. It's not going to have enough oxygen to function. And we've got lots of organs, lots of functions. So it's really important to keep that A1c in balance, right? Because it's coated with sugar, it's slow, raising your blood sugar, and also not able to get to those organs. And so this test, this A1c test, it measures that. It measures about 2 to 3 months. It's probably more really 3 months that it's really measuring. And what does that tell us? That tells us, and that tells you, well, maybe my nutrition and other things have not been going quite well the past few months, right? So we have that. It's not a good thing. It's not a bad thing. It's not about that. It's just so you can see where am I? Am I improving? Am I not improving? Just so you know, because remember, you know you best, right? So I want to make sure that you have all the knowledge and all the tools, right? You have all the power for this. And so we can help you get that A1c down, right? Which is what we want. So 2 to 3 month measurement. And usually your provider is going to do this test anywhere from 3 to 6 months, in a year, or they might do it less, just depending. If, you're consistently less than 7, some people are even less than 6. If you're, have good control and you're 80 to 130, and you're also, less than 180 most of the time, your A1c is going to be lower. It's a direct reflection, right? So A1c is high, blood sugar more than likely is going to be high as well, right? So doesn't always work out that way. It just depends on medication and other things. But that's kind of a good way for us and for you to know if you're able to manage your diabetes in a good way, right? So that this is a good thing. So on our A1c, just so we know, it's nice to know, right? We can't see our blood. It's the only way we know what's going on there. So we can't see it. It's kind of out of sight, out of mind, right? We don't want that. We want to be able to see it, understand it. We don't want to be afraid of the A1c.
Okay, so this slide we're talking about treating high blood glucose. So for instance, your blood sugar might be a little too high. You have too much glucose in your bloodstream. And the causes of high blood glucose, there's so many different causes. It could be nutrition related. It could be based on how your diet is, that it's causing your blood sugar to go a little too high after meals. Maybe it could be with your insulin, how you're taking your insulin, how you're taking your oral meds. If you're not taking it routinely or as prescribed, blood sugar could increase accordingly. Depending on maybe, how life is going right now. Maybe you're a little too stressed. You're dealing with emotional stresses of life. Maybe you're just like, this gas prices are just way too high. Might be a little too stressed out about that right now. I know that causes me some stress. So that, of course, could, correlate to increasing your blood sugar. So when you're having, high blood sugar, it's really important, just like I said earlier, just monitor your symptoms, continue to routinely check that blood sugar. And some of the symptoms, if you're having, high blood sugar, you can see here, you'll have increased thirst, increased need to urinate, tiredness, blurred vision. Those are some of the symptoms. There's a, laundry list of many others. And it's just kind of knowing how you're feeling. And if you're experiencing high blood glucose, go ahead and check in with your provider. You're feeling those symptoms, make sure you're hydrating, taking care of yourself, taking your insulin when prescribed. If there's something going on with your medications or you're unsure of, maybe you have some medication questions, you can ask Connor. You can check in, call IHC, check in with your provider, and continue to monitor that blood glucose the best to your abilities. Because if it does go untreated, there are potential for, possible, you could have some issues later on. So it's good to kind of know how you're feeling and monitor that accordingly. So the opposite of high blood glucose is low blood glucose. So with low blood glucose, essentially our blood sugar is too low. As we were talking about before, glucose fuels our body. It's the gas in the tank, if you will. And if we have no gas in the tank, then we're not going to be able to operate and function as well as we can. Our body relies on that glucose. Our brain relies on that blood sugar. And if we don't have enough of that, then our body's not going to be able to function properly. So when we're dealing with low blood sugar, just again, it's important to, check in on your signs and symptoms. Maybe if it's generally the range we're looking for, if it's low blood glucose is going to be under 70. So you might be sweating, cold, clammy skin. If you're feeling dizzy, any tingling feelings, fast heartbeat, headaches, confusion, irritability. Generally with hypoglycemia, low blood sugar, you're going to have mood swings. So your feelings might, suddenly change. So it's important to know, what are the steps to take after your blood sugar is just a little bit too low. So our tips are maybe eat or drink some kind of fast acting carbohydrate. Depending on that carbohydrate, I'm sure Misty could give you some, healthy alternatives for that carbohydrate that could work just as efficiently, what kind of juices you could have. And then after 15 minutes, make sure that you repeat that step, check again. If it's still low, call your provider, check in with us to make sure that, everything is working okay. So it's, again, just knowing how your body's feeling. Nobody knows your body better than you. So it's important to check your blood sugar, know whether it's high or low, and what are the steps to take accordingly.
Okay, meal planning, my favorite. I'm a big advocate of meal planning. I make a menu at home myself. for, every week, so that everyone gets to say what they want to eat. And it saves tons of money by making a meal plan or menu, if you want to call it that. And it's super easy and it keeps you focused. But more about that if you come see me. So what do we want to do? What do we have to do nutrition-wise to manage our blood sugar? Well, the great news is it's super easy. There's no weighing, there's no counting, there's no measuring, none of that. You just take your plate, whether it's a paper plate, plastic plate, a porcelain plate, whatever. You just take your plate out and you make your meal. But when we're making our meal, we want to make sure that we've got half of our plate's got some veggies on it. All right, some green on there, some salad, some broccoli, carrots, some great vegetables, squashes, yellow squash, zucchini squash, mushrooms, onions. I mean, the list goes on. Fill that plate with some veggies. Just make sure those veggies are not potatoes or corn, okay? Those go somewhere else. Then the other half of our plate, there's room for that quarter of that plate, protein. And that's your animal sources, some eggs, cheese, plain yogurt, not yogurt with granola and M&Ms and little characters in it, just plain old yogurt, okay? That's easy, right? It's going to be a little bit cheaper. And then the other quarter of that plate, that's where the sweet starchy foods come in, okay? So that's where those potatoes or corn could go. But also anything that's a bread, pasta, your rice, your tortillas, those types of things, you can have them. Just don't want to have our whole plate filled with spaghetti dinner, okay? Have a little bit on the side. So what would that look like with a real dinner? You'd have some spaghetti in the quarter of the plate, and then you would have a nice salad on the side, okay? Springtime is coming up, right? Sunday, we have spring coming in. So a lot of great produce is going to be out in the springtime. We have some asparagus, and they're all, guess what? Non-starchy vegetables, which we really want to have. It's going to help stabilize your blood sugar, give you tons of nutrients into your body. You're going to feel great. You're going to be kicking and screaming and running around, and you're just going to feel excellent. More green veggies. And then the final part, which is my favorite part, and which is really the most important next to the vegetables, is those healthy fats. Healthy fats are nuts, seeds, fatty fishes like a salmon, olive oil, in particular, extra virgin olive oil, avocado, and avocados themselves. Out here in the community, there's tons of avocados, right? Pick one, have one with your food, slice it up, mash it up, however you want to eat it. That avocado is going to be excellent for that heart health, right? It's going to help protect our heart. It's going to help keep us full. And guess what? It's going to stabilize that blood sugar. Isn't that great? I mean, it's just something you can just pick. If you have them in your backyard, go get one. You can have them for breakfast, you can have one for lunch, whatever floats your boat, right? Get those healthy fats. And those are the two most important parts I really can't stress enough: healthy fats and veggies. Come see me if you need more guidance, more direction on, the healthy plate or the plate method, right? We're calling it the plate method. And there on the slide, you can see we're having tacos for dinner tonight. Okay. We have tacos for dinner. Tacos are excellent. We love tacos in California, right? We're taco eating people. So you have those 2 corn tortillas on the plate. You got your ground bison, maybe try some bison. You got some ground beef or ground turkey, ground pork, whatever it is, carnitas, whatever you want to have. But then look what's on the plate: salad, right? There's a big plate of salad with it. You can put it inside the taco. You can keep it outside of it. Either way, have your plate like that, and it will really start to help that blood sugar balance out. And then the healthy fat, where is that? Well, you could add some avocado. There's a little bit in that meat there that's in the picture. Or you can drizzle that extra virgin olive oil on that salad before you put it onto your taco or before you eat it as a salad. It will really, really pull you a long way. All you need about it is a tablespoon of it. You don't have to drink a gallon of it, just about a tablespoon of it, and you'll be feeling pretty good. You do this for your regular meals, things will start to come together. You have to give it time, right? We have to be patient, right? It's not going to happen overnight, right? Patience. You have to really, really be patient with it. Let your body do what it's supposed to do and be patient with it. And things will really start to work out for you. Okay.
All good stuff. All good stuff there. Okay, now we're going to talk a little bit about fitness, exercise, all that good stuff. So let's talk about activity in your life, especially if you have type 2 diabetes. If you're looking to jump into a fitness program, whether it's with me, maybe your local gym, it's very important to consult with your provider, check in with them, make sure that you are okay to exercise prior to jumping into a program. So activity in diabetes, physical activity supports diabetes in many ways. It's very important to, be active in your life, and because it will help manage your blood glucose levels. If your blood sugar is running too high, exercise is a good way to help lower that with some form of aerobic exercise. And it also helps other conditions. So if you have high blood pressure, maybe high cholesterol, and you're getting 150 minutes of aerobic exercise per week, those will help improve some of those conditions or help better manage them. And it also helps our ability to use insulin in our body. So the more we're active and we're on a program that we enjoy, it could be effective in supporting some of our health conditions. So there's plenty of different types of activity. If you'd like, you can give me a call, contact IHC. I'm more than willing to talk to you through different types of programs that, fit your interests. Walking and lap swimming, those are two ones that come right off the bat that are very, simple, that I think everyone can kind of, be a part of and accomplish at least 150 minutes per week. And you can definitely make it moderate if you're walking, in the morning or at night, depending on your routine. It's a good way to support your blood sugar and help meet your activity goals. Helps also with, managing weight. And also, like I said before, if you're dealing with some kind of stress, sometimes it helps to go for a 15 to 30-minute walk to, lighten the load there. I do like swimming. I think swimming is very effective if you're maybe someone who, has a hard time with walking, jogging, running, those kind of activities. Swimming's a little bit less on the joints, a little bit easier to accomplish. If you're someone who's looking into strength training and you've never done, you haven't lifted weights before, I think it's important maybe you have a conversation with me, have a conversation with another personal trainer to, maybe start you on a regimen that's kind of simple and help you build your way up to build muscle. Because when we're lifting and we're building muscle, it's an effective way to have that blood sugar go to our muscles. That glucose will go to the muscles first before it goes to other areas of your body. So having a lifting program can be effective in that way. And if possible, you're getting older, you're not able to do some of the sport activities that you used to enjoy in the past. There's plenty of other games that, require some sort of physical activity, like pickleball. It's like a short version of tennis, something I really enjoy. Cornhole. I mean, you can play cornhole probably for a couple hours and burn a lot of calories. You can walk up to a couple miles. I've worn my Apple Watch before and I've played cornhole and I racked up, I think, like 5 to 10 miles in just, a weekend's worth of games, which is kind of incredible because, it is a pretty simple game, but you lose track of time when you're having fun. So just generally, just pick something you enjoy, something that's worth your while. And then my last kind of saying, my motto here is motion is lotion. The diabetes team is probably sick of me saying this every single presentation, but it's true. I mean, the more active you are, as we get older, it's tough to say, but we do lose bone mass. So it's inevitable that we will get weaker, but the more active we are, the better we'll be able to preserve our bodies and be able to have maintenance for our bodies. And if we take care of our bodies and we treat ourselves with respect, our body is going to reciprocate that and protect ourselves. So the more active you are, the more you walk, more time you spend with other people, the more time you socialize, all of that is going to only help and provide your body with more wealth. So that's my little tidbit on exercise. I'm gonna go ahead and pass it forward.
I'm not getting sick of hearing you say motion is lotion, Wyatt. I like that saying. But but about medications, I just want to start off. And when I go to people's houses, people like to call me a pill pusher. And my response to that is, I kind of am. I've seen firsthand the response of people who aren't taking their medications as prescribed by their doctor. And I've seen blood pressures start to decrease. I've seen blood sugars start to decrease. This medication, it's pretty important in just keeping blood sugar under control as prescribed by your doctor. But I also just want to give a huge shout out to Misty and Wyatt, who they just spoke to you about, dieting and exercise. And that diabetes isn't just like something that can be controlled by one thing, or you have to do that, or you have to do this, but is almost like a whole person disease, mind, body, soul. And that we have a team here, Wyatt, Misty, myself, and Lorelei. We're here to support you, whether your needs are diet, exercise, or taking medications, as I'm about to discuss. So there's different types of medications. Some of these medications, if you were here last month and you heard me talk about some of them, I don't have much experience with inhaled medications, but injections, that's usually your insulin medications or your other medications like Ozempic or Trulicity. There's insulin pumps that automatically give you insulin throughout the day based on your blood sugar readings. And there's oral medications, which is most people's favorite medications. And the most common oral medication would be metformin, which is usually the one that doctors prescribe first. Oral medications are usually people's favorites because I think being stuck with a needle is just universally hated by like everyone in the world. I don't know a single person that likes being stuck with a needle. But if you were prescribed insulin by your provider, still have to highly encourage you to take it as prescribed. It'll do wonders in helping you. And so when managing your medications, there's three things. And I'm kind of going to read off the list, but also want to add my own input that you got to be aware of when you're managing your medications. Being aware of drug interactions. So some people, they're taking herbs, they're taking vitamins, they're taking supplements on the side. And you have to be aware that herbs or vitamins or supplements or other medications that you're taking that are over the counter may have two different effects with the other medications that are prescribed by your doctor. You might be taking a herb that will increase the effectiveness of your diabetes medication. In that case, it might cause a higher risk for hypoglycemia. Or you might have a herb or medication that you're taking that will decrease the effectiveness of the prescribed medication you're taking. And so whenever you're with your doctor and you do have a question about herbal supplements and vitamins, just bring that up and just see like, hey, doctor, is it okay if I take such and such herb while I'm taking these medications? Sticking to a routine, you see that in the middle, extremely important. And it's also one of the reasons that I think people prefer oral medications so much. It's easier to stick to a routine with oral medications. Because you can kind of keep them all in one place. You can keep them in your pill box and you say, oh, I have to take more oral medications. And it's like, you take them, you're done. But we recommend there's some insulins that you have to take regularly, like long-acting insulin, but we recommend taking them at the same time every day. And so sticking to that routine, sticking to the medications as prescribed will help with keeping your blood sugar under control. If you start to, not take them as prescribed and then your blood sugar starts to go up, that may be one of the reasons. And tips for medications: do not change or stop taking medications, which you're probably like saying, well, yeah, Connor. But unfortunately, a lot of people, they sticking yourself with the needle can be pretty hard. Part of our training for diabetes is they made us test ourselves for blood sugar monitoring. And I hate it. I hate sticking myself with the needle. So I totally empathize with people who they don't like taking certain medications and say, oh, this medication's giving me a bad side effect. If that's the situation, I would recommend making an appointment to your provider and talking to your provider to see what the other alternatives are that you could explore. Refill your medications before you run out and prepare a travel kit. I think that these two kind of go hand in hand. I've had situations before a patient kind of called me up like panic. They were like almost out of medication. They had like 1 day left. It was about to be a winter vacation. No one's going to be in the office for several days. We want to try and avoid those situations where you're about to run out of your medication that you really need the day before Christmas. But if you call my number, extension 5299, I do have experience helping people get medication refills, getting supplies that they need. Prepare a travel kit. We're going to talk about that in a slide coming up. And talk to your provider about side effects. That kind of goes hand in hand with not changing or stop taking your medications. Because again, like some people take like a medication and they'll tell me like, hey, it's giving me like stomach aches. I don't like it. And so they'll just stop taking it. Talk to your provider. There's a whole like list, like dozens of medications that might be alternatives that your doctor may be able to prescribe to you if you speak to them. Maintaining your health. Here we go. Going to skip past this slide and go over into stress and sleep. Now, when I saw this slide, when I was studying the slides earlier, the first thing that popped in my head was daylight savings time. And when daylight saving times hit, it hit me hard. Maybe it hit you guys hard too. I need my 7 hours of sleep, and so that Monday when I came back to work, I was basically dead. So it took me a few days to just to readjust daylight savings time. This sleep is just so important. It's essential, and it also goes hand in hand with stress. Our body reacts to stress and a lack of sleep by increasing blood sugar. There's this complicated system of like glands where if your body's starting to experience stress, one of the reactions that it has is bumping up the blood sugar that's in your body, which may explain why you're having a higher blood sugar than usual. Diabetes toolkit. Now this is pretty cool. Just going through it real quick. Logbook, Lancet, fast-acting carb, test strips, ID bracelet, syringe, insulin pen, diabetes medication, meter, ID card. Some of you, if you're brand new diagnosed with diabetes, you might get overwhelmed with all these things that are thrown at you all at once, telling don't eat this, do that, and just having all these supplies thrown at you at once. Some of you may not have these supplies. You're like, well, where am I supposed to get a daily diabetes logbook? Well, that's where I'd recommend scheduling an appointment either with myself or Lorelei, one of our home representatives, or you could schedule a diabetes clinic appointment with one of your providers here at the clinic, and we can help you get a hold of these supplies, get you that team support where we can help you understand how to use supplies and keep your blood sugar under control. Public health visit. Now, this is one that has a special place in my heart. And just with the public health visit, myself or Lorelei, or we have another public health nurse, but her specialty is not diabetes, Rolina. We go to people's homes and we offer a variety of services when we go to people's homes. One of the top ones is we check people's vital signs. There's been times in the past where we've gone to a house, the vital signs were extremely bad. And we had to call 911 to help get the person to the hospital. And we could check your vital signs, see like, is your blood sugar too high? Is your blood pressure too high? Do you need like an adjustment? And so we're kind of the in-between guy between you and your doctor to see if you need to come into doctor medication adjustment. And we can also help schedule appointments. I know it can be kind of frustrating scheduling an appointment with your doctor. We can help facilitate that. You can call me extension 5299. I'm pretty good at scheduling people for appointments, trying to find that like hidden slot that might be in between patients that a doctor might be able to see you a little bit earlier. But no promises or guarantees on that one. And then we offer so much more services with public health visits. Like I said, blood sugar checks, medication refills. We can help you with referrals, give you reminders, tell you when the referral is, follow-ups, educate you. Hey, you want a one-on-one? You want to say, what is diabetes, Connor? And we can go through it again. I love talking to people. I love education, and we just offer many more services when it comes to our home health visits. And here's our support team once again. If you didn't write down our phone numbers before, there it is. You can call my phone number, extension 5299. You want to schedule a home visit. You could also call Lorelei Legaspi, She's pretty famous in the community for her amazing cooking, by the way, if you want to have her for a home visit. We also have Wyatt, our physical activity specialist, Misty, our registered dietitian, and I'd like to open up the floor if there's any questions. Oh, and we're being told by our moderator that no questions have come in. Wyatt, Misty, do you have any comments before we end for the day?
Thanks for joining us.
Thanks for joining us, everybody, and have a wonderful Thursday.
Bye.